Hello, bellicon family. Faith here. I am super excited. I have been wanting to interview Dr. Kelly Sturm now, actually, for a really long time. Little did you know that you've been on my hit list. So I'd love to introduce to you all Dr. Kelly Sturm. I'll give you a quick bio, and then I'll let Kelly introduce herself. So, Dr. Kelly Sturm has a doctorate of physical therapy. She is a certified lymphedema therapist, board certified oncology clinical specialist with over a decade of experience with lymphedema and oncology physical therapy. You also have amazing education resources website. Like, I love your YouTube channel, your website, all that you do. So thank you for being here. Is there anything that I missed, like, that you want to share with your intro?
No, that's great. I appreciate it. Thanks for having me. That's exactly right. I've been a physical therapist for just about 12 years now and lymphedema therapist for about 10. And I'm doing the online education and YouTube for, I think, 6 years now. I'm just sharing what I know as much as possible.
Awesome. So one of the biggest things that comes into my world constantly is just that people come in and they're not sure if they can rebound, if they have lymphedema, if they have had cancer, and when to start it, and all of that. But the biggest thing that I'm realizing is there's kind of this gap between the medical world and the rebounding world, where I think a lot of medical professionals don't know what rebounding is, or if they've heard of it, I think they imagine like a big trampoline. So I think my biggest first question for you would be, what could you share in terms of rebounding for the medical community, so we can kind of break these myths and educate, specifically with your patients and like your specialty with lymphedema, with oncology and all that. It's like, what could you
Yeah.
share?
Yeah, absolutely. No, I actually was new to rebounding until one of my patients brought it to me, and I had to look into it a little bit more. And we, as the medical community, specifically for me in physical therapy and lymphedema therapy and oncology therapy, really drive home how important it is to find exercise. And for me, on top of that, with my patients, I really push them to find something they enjoy doing. And for some, they really enjoy rebounding because it's can be quick. It's can be I'm in Minnesota, so it's freezing here half the year. And so it's not something people can go outside and go for a walk or anything. So it's something inside that they can do at home, gets their heart rate up, is really beneficial. So it's just for us in the medical world, it's important to know that it's just another form of exercise that can be really efficient and effective for our patients.
That's super helpful, because we get a lot of people come and they're like, "Can I do this?" And so I'll say, "Oh, it'd be great to check with your doctor first," and then they'll kind of go to their doctor, and their doctor's like, "Well, I don't know. I'm not really sure what rebounding is." So that's super helpful to know that you actually did the research yourself. Like, you're amazing. A lot of people don't do that, and to look to see. So what was your process of like research? To what were you looking for to make sure it was safe for your patients?
Yeah, and you're right, everyone is different. So we do have to ideally look at each person and, what they have going on medically. But for me, as far as lymphedema or the lymphatic system and also oncology, I'm looking at first off, I need to know, is it safe? And generally it is safe unless someone has an issue like a fracture or any bone issues that we need to watch closely, that we're a little more hesitant for it with jumping. But overall, it's really safe. And not only is it safe, but it can be really beneficial in more ways than one. It's more beneficial, I would say, than even walking or something simple that we typically encourage people to do. So when someone's trying to find that next level of exercise that they can try to benefit them, rebounding is definitely an option. We just want to make sure that they're safe with it.
Yeah, that makes sense. Do you, in terms of safety, like, recommend the T bars or the support bars, or are you more thinking like that they stick to closed chain work, like work with their feet on the mat the whole time?
Yeah, it's a really good question. I think the number one thing that I see is concerns about balance
Yeah.
and someone's coordination and just feeling comfortable. Because if you're new to it, you do want a T-bar or something to hang on to feel comfortable, because it takes a little bit to get used to if it's your first time. But most people pick it up pretty quickly. From there, it's still nice to have available is keep the T-bar nearby. And then when it comes to bouncing, I just say start really light and maybe lifting up an inch or two off. So small jumps are usually just fine versus just doing closed chain.
Yeah.
But I know some people feel more comfortable keeping their feet
Yeah.
in contact all the time, and that's okay. You'll still get a lot of benefit there too.
Okay, that's awesome. That's really helpful to know. You're answering so many questions that we get calls about. So let's start with lymphedema. So could you share just some of the a little bit about the benefits and why you might recommend it to a patient of yours who comes with lymphedema, and maybe like where to start?
Yeah. So traditionally, as a lymphedema therapist, we were taught in training, a decade plus ago, that we want to do just basic exercises or movements to get lymph flowing. And that has really grown into as we learn more about how the lymphatic system works. So we know that if you think about your heart and your veins and your arteries, your heart is what pumps blood through your body. It naturally will pump and push blood through. But your lymphatic system does not have that natural pump. Your lymphatic vessels rely completely on your muscles and those muscles contracting in order to move lymphatic fluid through your body. And so we just need to find something for someone to move. And so rebounding is a great way. It's full body. Yes, it's going to get your heart rate up and be beneficial cardiovascularly, but for lymphatics, so lymphedema or another lymphatic issue, or just lymphatic wellness, jumping or bouncing on a rebounder, doing movements, full body, you are going to get your lymphatics moving naturally the way that they're supposed to. So there is absolutely benefit for lymphedema and anything that goes along with lymphatics simply because the fact that you're moving your body.
Yeah, that's amazing. Would you say that the next question we get is how long? Everybody wants to know how long. And I usually tell them like any movement is good movement. Just start with something. Do you have, yeah, like a minimum or maximum or anything in between of length?
It's a really good question. Because someone is typically new, I will usually say just start with a few minutes,
Yeah,
start with 2 or 3 minutes and just see how your body feels and gradually build up. If someone really likes a hard number, I say 10% a week.
yes,
So
you have
adding
those
on a
people.
minute
You
or
know what I'm
two.
talking about.
And some people are okay with just saying, hey, add a few minutes at a time or, over time. I think depending on the type of exercise and what someone's looking for, even 10 minutes is great.
Yeah,
But working up to in a day, I would say you can break this up into multiple times. It doesn't have to be at once, but 20 minutes up to 30 minutes a day of some sort of movement is we know is the best thing for someone's overall health.
yeah,
And so it is okay if someone's like, that's a lot for me at once.
yeah.
Maybe you have and take a break in the morning from work and go do 5-10 minutes in the morning, and then you jump on 5-10 minutes in the afternoon, just move your body. That all adds up. But again, start small, ease in, and gradually build up.
Yeah, I love the idea of breaking that up between the day. Actually, that's simple and brilliant. Super. So let's kind of like transition more into the cancer field, oncology, which I know is a big topic because it's so different depending on what you have going on and the individual and the type of cancer. What is your main focus in the oncology world?
So I focus on the rehab side of it. So I see individuals who have side effects or symptoms that come from the cancer itself or cancer treatment,
Yeah,
and we work through to reduce those. So the number one symptom or side effect of cancer treatment out there is fatigue. We know 99% of people will get some level of fatigue, even if it's a small amount. Definitely if they're having chemotherapy, definitely if they're having radiation, but also surgery can be tiring too. And if we know, and we could have pages and pages and pages of research on what helps cancer related fatigue. And the number one thing out there proven over and over again is exercise. And so what a lot of what we do is try to get someone on an exercise regimen. Again, we tailor it to someone, but find something that they can do. We start slow and gradually build up. And that has been it is the number one way to help combat fatigue. And then it's also helpful for strength, which weakness happens with cancer treatment, balance issues with chemotherapies, lymphedema that comes along with it, with surgeries. There's so many things that exercise is beneficial for. And rebounding is just another way to get that exercise in for someone that can benefit them in multiple ways.
that's awesome. Do you, and again, this might be so unique to the individual and the type of cancer, but do you usually recommend rebounding like leading up to treatment, during treatment, after treatment? Like, is there, again, you may not be able to answer that because it's so unique, but in general, what would you say?
Yeah, I can answer that. Their research is showing all of the above. So we know that if it's not that easy, when someone's diagnosed, typically a lot comes at them really quickly. But if someone is exercising before, we know that their outcomes from surgery outcomes, a shorter hospital stay, quicker recovery will happen if they were exercising prior. During, it's shown to be safe. Exercise is safe during treatment, and then definitely after, and then decades down the line as well. So it has shown that exercise can be beneficial no matter where someone is at on the continuum of their cancer journey.
Wow, that's this should be serve as inspiration for. I'm like, I need to be bouncing while we're doing this exercise. It's amazing. And then specifically, would you say rebounding is what would be unique about rebounding for the oncology world compared to other forms of exercise?
Yeah, we always want to think about safety no matter what, but it definitely comes into play a little bit more at the forefront when it comes to oncology. We need to consider what kind of treatment someone has and how it affects them, and specifically some chemotherapy drugs or some radiation treatment, depending on what it is. We know that their bones can be affected. Hormone treatments for things like breast cancer or gynecological cancers or even prostate cancers, they can affect bone health. So we just need to look at someone and see what are they doing, and are they safe from any issues with their bones? Do they have cancer in their bones? Those are probably the big ones. From there, exercise in general is helpful, so we don't consider that. But we also want to consider heart health and lung health, where the cancer is, are they getting treatment in these areas, and does that affect how they move around? And then lastly, if someone's in the middle of treatment, we'll also watch their blood counts and blood levels, and know how intense they can be exercising, also for safety. So yes, we do look more individually, but in general, it's safe. We just need to look at where each person's at, again, with their treatment.
Sure. And would you say some people will come to me and say, what can I get out of, if I had to choose between, going for a run or rebounding? And I love what you said about joy, because I tell people that too. I'm like, do what moves you, do what brings you joy, which would be surprising coming from me, but I love that. But if somebody might say, if I had to choose between running on the bellicon or the concrete, is one have more health benefits for me? Like in my rehab stage of cancer. And so sometimes I'll think about, can they build bone density back up on the rebounder? Is it good for lymphatic system? Are there any, I guess, unique benefits for rebounding where you might kind of push people to say, hey, yeah, if that brings you joy, I would consider that over something else. I guess, yeah, what are the unique benefits on a rebounder for your oncology patients compared to other things, if there are any?
Yeah, I think one big one, well, there's a couple. Balance is an issue for many, is if they have chemotherapy and they're having neuropathies or tingling and numbness in their feet
Yeah.
and have balance or coordination concerns. We want to make sure that they're safe, and running is not always safe, but if there's, we either, something that they can hang on to for exercise is usually safer. So that would be something to consider. I think another one that I actually see that it's not always because of the cancer treatment, but we see so many who have come into us or come to cancer treatment already with joint issues.
Yeah.
And when you think about rebounding, even personally, my first thought was like, how does that feel on someone's joints? But when you try it, and specifically bellicons itself, because of how you guys have created this, is I call myself a retired runner. I don't run
Yeah.
anymore. I used to be a couple marathons, and now I'm done, because my joint, it doesn't feel good on my knees anymore. But I can rebound for 20 minutes and have no issues whatsoever. So I wouldn't look at it as the jumping and consider like, oh, that's going to be hard on the joints, because actually it can be more gentle on someone's joints versus going out on the concrete. So something I would consider as well.
Yeah, that makes sense. That's awesome. So gentle on the joints, and then yeah, they get the added bang of the lymphatic stimulation too, which I think, yeah, in rehab for cancer is always, good for, I would assume, really good for their immune system and rebuilding that up. I
Yeah,
think
there's so many benefits to exercise in general. And
yeah,
again, so this is a great way. I think it's efficient, it's effective, it can be short. You don't have to be on the rebounder for an hour if that's not something that you have time for. It can be 15, 20 minutes. You can get a lot out of that even short period of time.
that's super helpful. Kelly, thank you. Is there anything that you would want to add for anybody in our community, like who, if they have questions, or yeah, any thoughts, any inspirational stories as we close up?
I think the biggest one, and I've learned this from my patients and patients who have taught me what rebounding is and how it helps them, is everyone is different, and everyone is going to find something that fits what they're looking for. And when it comes to lymphedema, when it comes to oncology, one size doesn't fit all. And so if you're not sure, if you are looking for something new, just try it. It could be something that you really enjoy doing, something that you feel like works really well for you and that you're finding benefit from. It doesn't hurt to try, again, as long as you're cleared for any major safety issues from your doctor or your team. Definitely something I would consider.
Amazing. Thank you so much, Kelly. This was really helpful for me, and I think it will be really helpful for our community too as they enter their journey. We will link to your website. Hopefully, everybody doesn't bombard you with too many questions, but please reach out or comment. Kelly's just like an amazing resource and wealth of knowledge, and I love your videos. So thank you.
Thank you.
Yeah,
Thanks for having me. I appreciate it.
of course. All right. We'll see you soon.